who you may know from her work in laryngopharyngeal reflux, LPR. She is a board certified otolaryngologist with further subspecialty in laryngology. She is an expert in all things voice, airway, LPR. She's published in over 30 peer-reviewed articles, trained at Harvard, Northwestern, and we're so lucky to have her here to talk about hiatal hernia management. And if you're new to me, my name is Molly Pelletier. I'm a registered dietitian and I specialize in digestive health, acid reflux, GERD, LPR. So today our topic is going to be about hiatal hernia. How do you understand this? How do you manage this, and potentially manage this condition when reflux is associated with a hernia without surgery, with nutrition, with other modalities? So I think it would be helpful just to talk about kind of what a hiatal hernia is and how it affects digestion, how it can impact reflux.
Sure. So thanks, Molly, for that wonderful introduction. I really enjoy our conversations. So, what is a hiatal hernia? So, a hiatal hernia, simply put, is when part of your stomach, so the top part of your stomach, comes through what's known as the diaphragm. And there's normally an opening here in which the esophagus fits. And that part of stomach coming through the diaphragm into the chest is known as a hiatal hernia.
Mhm. Yeah, very helpful to know. Yeah, and so, can you talk a little bit more about the connection between hiatal hernia and reflux?
Sure. So when we think about reflux, we're talking about the upward movement of things that are in the stomach coming out into the esophagus. So that portion of a hiatal hernia, because it's now located in the chest, it's being exposed to different forces than when it was in the stomach. So the chest has a lot higher pressure because of the lungs than the stomach does. So that part, whatever's in the part of the hiatal hernia, is more likely to reflux upwards
Mhm.
and come out into the esophagus. These hiatal hernias are often associated with weak lower esophageal sphincter tone as well. And so that compounds the problem, contributing to reflux.
Mhm. Yeah, yeah. So it sounds like the symptoms are, typically GERD, LPR, but maybe it'd be helpful to talk a little bit more about the symptoms and like how they overlap. If there's any specific symptoms that might be more so associated with hernia.
Sure. So when we think about a hiatal hernia, again, we're talking about that mechanical movement. And classically, that's associated with things like feeling regurgitation or heartburn. Where I get kind of involved in all of this is as a specialist of LPR, we often see hiatal hernias as essentially the root cause for why a patient is having reflux that is causing their silent reflux symptoms, which is like mucus and throat clearing. So that's usually how I identify these, is when I'm working patients up for chronic postnasal drip, cough, mucus, hoarseness, and we're looking for the root cause of why they may be having reflux episodes. Oftentimes we come across in our workup a hiatal hernia.
Yeah, yeah. Do you see the severity increasing with the size of the hernia in
Yes,
terms of
definitely.
symptoms?
So the larger portion, or the larger the hiatal hernia, the more likely there is to be reflux associated with it.
Okay, got it. Yeah. And so when someone, when this is found, what are some of the strategies you may be discussing with your patients as an ENT, or potentially like nutrition, lifestyle strategies as well that you often bring up?
Yeah, definitely. So I think whether patients have a hiatal hernia or not, but we suspect or we've diagnosed them with LPR, our recommendations are generally the same. So we're looking at things with the diet and the lifestyle that help reduce that mechanical reflux. The caveat to that is when we identify a hiatal hernia, we know you're going to be more predisposed to mechanical reflux than someone who maybe doesn't have that. So what I mean by that is a lot of times reflux can simply be due to what we're eating and drinking and when. But if you have a hiatal hernia, you're going to be more predisposed to reflux, even if it's with water, than the average person.
Yeah,
So,
yeah.
mhm.
Yeah, so in terms of lifestyle changes, we talk a whole lot about this in all of our previous interviews. I know when it comes to a hernia with the likelihood
Mhm.
of mechanical reflux, I'm talking a lot about mealtime hygiene, is what I like to call it, but it's all essentially mindful eating. Because, like you
Yes.
said, sometimes this can happen, when you're not having reflux triggers. It may not be necessarily like the food or the beverage, but when it comes to a hernia, I have found that slowing down during your mealtime, chewing
100%.
your food well, really trying to get in tune with your hunger and fullness cues. So not going too long in between your meals so that when you get to your meal, you can eat to like 80 to 90% fullness. I found that that's really helpful for people with a hernia.
Yeah, I think one of the biggest recommendations I have for people with hiatal hernia is portion control, because
Mhm.
essentially we're talking about distending the stomach, especially that portion that's in the chest. And
Mhm.
so just by being mindful about portion control can make a huge difference. So, with hiatal hernias, a lot of times I'm not so focused on kind of the acid part of the diet because again, we're talking more mechanical issue,
Yeah.
not acidity or acid reflux. So I'm really focusing on, making sure you're sitting upright,
Yeah.
not laying down soon after eating, avoiding things with bubblies or carbonation that are more likely to rise through that part of the hernia, and
Mhm.
then focusing on things that help that make the sphincter weaker. So things like caffeine relax that sphincter. That's the opposite of we want in this situation.
Yeah, I was thinking the same thing that for my clients with hernias, it tends to be those foods that actually directly impact the sphincter in terms of caffeine, alcohol, the carbonation, even that can put pressure and on the sphincter, and more so, that kind of differs from LPR, laryngopharyngeal reflux, where the acid may be more problematic for a lot of those people. And of course, individual triggers differ, but definitely with the hernia, like the things that can loosen the sphincter, even chocolate, which has theobromine in
Mhm.
it, that can loosen the sphincter, things like that. We kind of want to find, what is the threshold amount? Like, can you have maybe a small square of chocolate versus like a big slice of chocolate cake? That might be a totally different experience. But watching those things for sure that would loosen the sphincter temporarily. Yeah.
And what's difficult about it is, as a healthcare professional, when I make recommendations, a lot of times they're very general and
Hmm.
broad, but it's up to kind of, to be very frank with you, patients to kind of get a sense of their own triggers and learn about those thresholds themselves, because there
Yeah.
is no data on, if you have a 1 centimeter hiatal hernia versus a 4, can you have more chocolate than another person?
Yeah.
Those guidelines just don't exist. We don't have that data, and I definitely have seen both ends of the spectrum. I've seen people with 4 or 5 centimeter hiatal hernias have minimal complaints of things like general reflux or LPR, whereas I've had people with like a 1 or 2 centimeter one that are just so bothered by the mucus and phlegm. And so there definitely is something more than just the hernia that's contributing to symptoms. And that's
Mm.
probably another conversation we can have. But generally, trying to reduce mechanical movement in any way possible is really important.
So glad you brought this up because I definitely have clients that will come to me and they almost feel like they are destined for a life of suffering with reflux because they have a hernia. And I think that's really important to acknowledge that there's always multiple things that could be contributing to your reflux. And
Right.
like you said, a lot of the advice on the internet is general. And one of the most helpful things that I've found with my clients is food logging, actually, is really understanding, like looking at the timing of your meals, the size of your meals, and then when we are able, sometimes it's hard to identify your threshold amounts of triggers if you're
Mhm.
symptomatic all the time, if you
Right.
have reflux all the time. So our goal is usually to bring those symptoms down, get them under control, and then we can start to understand what are your unique triggers so that you
Right.
can kind of understand that for your long-term quality of life, and you're not feeling like you're playing whack-a-mole with food all the time and not sure what your triggers are.
Right. I completely agree with you. I mean, some by the time patients usually come to see us, it's things are usually out of control, frankly
Yeah.
speaking. And so our first step is to get not necessarily symptom resolution right away, but to
Mhm.
kind of help reduce the frequency and severity so that triggers can start to present themselves. And so that's why initially we can be very strict with recommendations in terms of diet and lifestyle. But
Yeah.
usually we can get patients to a more comfortable place just by identifying those triggers. And so I
Yeah.
agree with you on that.
Yeah. Yeah, exactly. It sounds like we have a similar approach there. So yeah, what in terms of bringing those symptoms down, what role do medications, supplements play in that?
Yeah. So I think, one thing that I think is always a little shocking or maybe new for patients is how these recommendations on medications and supplements can really vary depending on which subspecialist you're seeing.
Yeah.
So gastroenterologists or GI or stomach doctors have a kind of a different view on things than maybe ENT or laryngology. So again, I'm speaking on behalf of being a laryngologist. So when I see patients for LPR and they are having kind of mechanical reflux, my initial aim is to help reduce the number of reflux events and the severity that they're having. And so, besides the diet and behavior, we usually start with kind of all natural, more supplements that can help. And so, this is primarily in the category of what we call alginates. So, alginates made of algae, which comes from seaweed, float on the surface of the stomach. So, these are perfect. I think this fits in very well with what we're talking about, trying to reduce that mechanical reflux by
Mhm.
creating a new barrier between that lower esophageal sphincter and what you just had to eat or drink. And so the alginate that I know we both really love is kind of Reflux Raft. It's available, all natural, kind of no drug associated with it. So it's a great kind of supplement for patients who are looking for something a little bit more than just diet and lifestyle. With that, in patients, what is the role of what we call acid suppression, your proton pump inhibitors? Again, I always tell patients, listen, if there's not frank acidity or heartburn symptoms, then the role is very likely not a big role in that. The caveat to that is if your stomach doctor has looked down there and they found really a lot of inflammation or even what we call Barrett's, which is tissue changing, acid suppression is usually recommended to help healing, but not necessarily LPR symptoms. So my practice has very much changed over the last 10 years, 9 years of being a laryngologist, where I actually don't use acid suppression a lot unless patients are saying I'm also having heartburn, in
Mhm.
which case we would still try the diet and lifestyle and natural things. So I think this is definitely a shift in conversation that for most people because they haven't necessarily heard this before. But I think especially when we're talking about a hiatal hernia, I mean, you cannot forget that this is a mechanical reflux problem, and you need to address this with something that's helping the mechanical reflux.
Yep, exactly. Yeah, so, like, acid suppression really does nothing to address the mechanical reflux, and so having that barrier is something we frequently use in my practice
Mhm.
as well, and I think it's such a helpful approach when we're in that phase of really trying to reduce the reflux events and reduce the symptoms so that we can
Mhm.
understand what are those factors that are impacting your reflux. Is it stress? Is it more postural? Is it mealtime patterns? Or there's so many things that could be impacting. So really grateful for Reflux Raft and Alginates because they've really helped my clients with hiatal hernia
Mhm.
from everywhere from 1 to 2 centimeters to 6 to 7. Like it's an approach that I think is really helpful and safe for long term. For those people with larger size hernias, it's great that we have an option that's safe for long term use with much. The side effect profile is extremely low compared to something like an acid suppressant.
And again, the acid suppressant is not stopping the reflux. And we know silent reflux can cause a lot of mucus and phlegm. And so we see this often where patients maybe initially did have heartburn with their hiatal hernia. They got put on an antacid. The heartburn seems better, but the mucus continues, right? And it's
Hmm.
because even water refluxing, which is not acidic, can trigger a lot of those upper aerodigestive tract symptoms. And so
Yeah.
I get asked a lot, is it safe or can I take an alginate with an antacid? Yes, you can. They're
Hmm.
not, mutually exclusive.
Hmm.
Alginates are used kind of after meals and at bedtime. Acid suppression, usually proton pump inhibitors are used first thing in the morning.
Hmm.
Whether you need one, both, really is a little bit individualized based on what your testing has shown.
Yeah. Yeah. That makes total sense. One question that I get a lot is, and I think is definitely a question for a doctor, but like, when would a patient consider surgery? Like, is there a certain size range where that would be?
Yeah. So I very frankly, I'm not a general surgeon and I don't
Hmm.
do these surgeries myself. So when we have this conversation or we identify a hiatal hernia in the workup, I always let patients know that surgery does exist for these, but
Hmm.
I would really defer on a direct recommendation to the surgeon who does it. And the reason I say this is I believe in getting information about your own health and making kind of your own decisions. And so, unfortunately, I have seen a little bit of gatekeeping when it comes to referring to surgery to have this discussion, and I don't believe in that. So, if I have a patient where we've identified the hiatal hernia, that is part of our conversation is diet, lifestyle, alginates, weight loss. We haven't touched on diaphragmatic breathing, but that's something else I
Oh,
often bring
yeah.
up. And then I say, listen, those, at the end of the spectrum of how you can intervene would be the most invasive thing, which is surgery. But I let them know that exists, and I kind of help plug them in with a surgeon who could then talk about, what are your options? What are the risks? Are you a good candidate? And then patients can take that information how they will. So I don't, if there's, I don't like telling patients, oh, I don't think that would be good for you, because I'm not the one doing that surgery. And
Yeah.
so my kind of goal is to help facilitate that conversation with them, just so that they know everything that's out there and exists.
Yeah, 100%. I think it's so important to do the research and understand your physiology. So I agree
Mhm.
with that. Yeah, so I wish I had my stomach pillow because I'm traveling right now. I don't have it, but diaphragmatic breathing, I'm so glad you brought that up because when we think
Mhm.
about the lower esophageal junction, we usually just think about the sphincter that helps to, close that pathway to prevent food from moving into the esophagus, but it's really also your diaphragm. Your diaphragm plays such an
Mhm.
important role in that lower esophageal junction, that protective barrier. So research has shown that diaphragmatic breathing can help strengthen and create pressure in the lower esophageal junction to prevent reflux. So I love educating my patients about diaphragmatic breathing post meal throughout the day. It's an amazing tool to not only help prevent reflux but also manage stress, which has been associated with reflux. So, yeah, I think that's hugely important, especially for someone with a hernia.
Yeah. And then other effects with the diaphragmatic breathing, it helps, the vagal nerve tone,
Hmm.
which can get super irritated and sensitive in patients with chronic reflux, LPR. So even though it's directly helping to kind of strengthen that muscular barrier, it also can help with the vagus nerve sensitivity. It can help
Yeah.
with the way the larynx functions, which can present with symptoms of LPR. So, you know, all natural, really great thing to incorporate if you do suffer from LPR, generally. So yeah, I'm supportive of it.
Yeah, that's awesome. That's awesome. Is there a certain like time frame you usually tell your patients in terms of like aiming for a certain number of minutes or breaths?
So I don't really make that recommendation for
Hmm.
patients. Usually we start with an intro course to basically belly breathing,
Cool.
and then if we find that they're having a lot of laryngeal symptoms, such as muscle tension or hoarseness or even spasms, then I usually get them plugged in with a speech language pathologist to do formal training in diaphragmatic breathing. Again, let the experts do what the experts know,
Hmm.
and using my role to help facilitate. So then I get them plugged in to do an actual program of diaphragmatic breathing, because I think some people, it's not as intuitive, if that makes
Yeah.
sense, how to do it. And I think a little bit of one on one kind of training can be helpful for that.
Yeah, absolutely. We do have some videos on the Flora app as well in terms of diaphragmatic breathing and how to do it. So that's a good place to start too if people are looking for more help. So for someone newly diagnosed with a hernia, oh, were you gonna say something? Did I interrupt?
Oh, no, I
Okay,
wasn't.
okay.
No.
For someone newly diagnosed with a hernia, what would be your advice to help them feel empowered in their health and kind of empowered in managing their condition?
Yeah, I mean, I think the first thing I would say is, a diagnosis doesn't dictate who you are or how you
Mhm.
feel. And we see a wide spectrum of how these hiatal hernias can affect people. I've had people come in and, frankly speaking, very terrified of this diagnosis because it might have been found on a scope or a CT scan done for a reason, and they really were not given any information about the implications. And so I would say that we see these commonly during workup. Symptoms and how they affect you can definitely vary, so don't freak out. We have lots of patients who never get surgery, but they can still feel better with some of
Mhm.
these interventions. So really, a hiatal hernia is just more, I tell patients, more of an indication that like what we're recommending about diet and lifestyle is important for you, right? It's not just
Yeah.
out there, oh, you have mucus, give up this or that. No, this is, we found some reason why you are having reflux or can contribute to reflux. So when we make these recommendations, we really recommend them for you. So it's something that you should incorporate into your life.
100%. I think one comment that I get all the time on social media that always really surprises me is when it's strategies about reflux that I'm sharing, whether it's nutrition or
Mhm.
lifestyle. People are asking like, "What about hernia? What do I do if I have a hernia?" And because of this connection, if you're suffering from reflux and you also have a hernia, these strategies still apply to you. So all the anti-reflux information in terms of reflux prevention tips,
Mhm.
mindful eating, lifestyle tips that we both shared still do apply. And it's really important, nothing beats personalized advice, but still, like, all of the reflux things that we've discussed today, and even in our other videos too about, diet modification and sort of taking a good look at your mealtime patterns, using alginates, that all really applies to people with hernia. So sometimes I think that they can feel almost like, um, there's so little information out there that it can be overwhelming, and then there's so much information about reflux, but there still is a lot of information that will apply. And I think just taking things one step at a time. With when it comes to getting a new diagnosis, it can be overwhelming. And making changes when it comes to reflux can be overwhelming, but just taking things one step at a time is a really great way to make progress.
Definitely. I love the baby steps approach, right?
Mhm.
Because everyone can handle one little baby step at a time, but when it's a whole thing, it can be very overwhelming. So I agree with you.
Yeah, absolutely, absolutely. Well, thank you so much for coming and chatting with us
Yeah.
today. I think this is really, really helpful, and we so appreciate it.
I appreciate you having me on. Thank you so much, Molly.
Great to see you as always.
You too. Okay.
Take
Bye.
care. Bye.